Hello, everybody. Welcome back to Manine's Nail Station. We are on Module 4 Nail Diseases and Disorders. A topic that one needs to know because you need to be able to identify whether or not you can put any product onto a nail with a disorder. Okay, so here we are going to look at mold, bacteria, and fungus. Our bodies are incapable of producing mold spores. Bacteria is a microscopic animal that lives on the top of the nail surface and thrives in dark, moist areas on the nail plate. Green in color, byproduct is green. This is why nail preparation is vital for a healthy nail. So we have to make sure that we prep the nail properly and that we don't, use unhygienic products. Implements, they have to be sterilized. You must make sure that all your files and everything that you're using is sterilized because you don't want one of those bacteria things getting trapped underneath one of your nail enhancements. So it's the same as like a mold that grows onto a bread. It grows in dark, moist areas and it thrives in that environment. So if you have to look at the nail and you've got lifting around the cuticle area and you've got, say, a darkish gel polish on top, and water seeps in underneath that together with a germ. Our hands are in so many things, whether we're cooking or putting on our makeup or whatever we're doing. The hands are one of the most dirty. Uh, um, Hands are the most dirty because it's everywhere. We use it all the time. So it's very important that your preparation is key to preventing a fungus or a greenie on the natural nail. And you don't want that to happen. That's why we all need to sterilize our files, all our implements, and hands. So when a client comes in, it's always best to scrub the hands, and to sterilize. A fungus is a microscopic parasite plant that lives under the nail plate, prefers a dark, warm, moist environment, starts off white, then it turns yellow and then dark brown, lives off keratin off the nail plate, appears first on the feet. Enhancements are not recommended. So if you've got a white nail bed and you can see straight away that it's lifting off the nail plate, you do not apply any nail enhancements onto that nail at all, as that will just promote the fungus to grow even more and create problems down the line. Okay, a nail disorder is an upset of normal functions within the body. Nail diseases, a disease is a destructive process in an organism with specific causes and characteristics. Enhancement should not be applied onto a nail with a nail disease unless a physician has given permission to do so. So if a client comes in and she has a nail disorder or a nail disease, make sure that you do not use any of your nail files or anything. And if you do, while removing, all of that needs to be thrown away because you will contaminate your entire nail station. And every single person, including yourself, when you start doing your nails, you are going to land up with that bacteria that's sitting on all your tools, and that will then be disastrous. All right, so let's have a look here. So this is now showing a hangnail. If you see here, so that's a piece of skin. That's almost like a little tag. What happens if you don't cut that when doing your prep? Clients will tend to grab it with their teeth and pull, and then that will tear the skin across, and that can be very painful because it can cause a whitlow. So you don't want that. If you look at the epinecium, so this is your lateral fold over here, can you see this white, milky, dry skin that's sitting underneath the epinecium? That is the cuticle, not the lateral fold. All right, people get that so confused. So that dead skin that's sort of crawling up as the nail grows with the nail needs to be removed, and you cannot build on top of that. If you put any product on top of that, it won't adhere to the nail, and you're going to land up with lifting, which then attracts moisture. And if it's in a dark area, you are in trouble, because you could then house one of those bacteria little organisms. So you never cut any live tissue around the nail, as that could cause bleeding and is not recommended. All right, so let's look at another nail disorder. So this is corrugation. So it's like furrows that grow down the nail, as you can see here. These are lines that grow down the nail like ridges. That's why you get bases that are ridge fillers, because it's a thicker consistency of a base that then covers up all those ridges. So you've got to be very careful to only lightly buff on a nail like this. All right, and apply a base coat. Long ridges running lengthwise across the nail plate increases normally with age. So when someone gets older, your skin gets thinner, and so does your hair. Your nails are made up of keratin, the same as your hair, and that gets thinner. They may have psoriasis, poor circulation. Frostbite can also cause this. Appearance may be improved by buffing the ridges and filling it in with an artificial nail. So you could buff lightly on top and then apply a gel to this nail. It's not a problem. Just be careful not to over buff a corrugated nail. Now, if you look here, this is the fuchsias. It's chapped corners, cracked skin at the corners of the nail plate. This is advising you to have regular manicures. Vitamin enriched cuticle oil applications, also maybe a paraffin dip would be good, and this is caused by dry skin. All right, and then it cracks and it can become quite painful. So very, very important to have regular manicures and to oil them. Okay, so here we've got a bruised nail, also known as a hematoma. So it's an injury to the nail bed. May cause a clot of blood under the nail plate. Sometimes the nail falls off during the healing process. If the matrix is not damaged, the nail grows back to normal. Artificial nails, nail polish may be applied. Okay, so all depending on whether the nail is actually lifting off the nail bed. If any lifting on the nail bed, do not apply anything. I wouldn't advise to buff onto something like that, because you've got a blood clot underneath the nail. That's the natural way the body then heals. So just make sure that you do not apply. Always ask for advice from a physician. So don't apply anything to that nail. I wouldn't take any chances with that. All right, so let's have a look at our next nail disorder. So this is called a ski jump nail. So what happens is, let's say you're a nail biter and you've been biting for many, many years. The nail grows out by ski jumping, and it's also known as a spoon nail. And it can be caused by trauma, iron deficiency. It can also scoop up from stress and can appear concave or spoon-like. Also occurs from nail biting over a period of time. Acrylic could be applied to this as well as gel to enhance the appearance. Now, if you look at this ski jump nail, this example, can you see there's this line, the split down the middle? So what's happened to this nail is sometime in this person's life, they have hit the nail at the matrix area, and that line of cells has been damaged permanently, and as it grows up over the free edge, it splits. There's nothing you can do about that except overlay that natural nail, which is the best thing to do because that will just hook on everything and create more damage. So a nail like this is a very, very good candidate for applying a gel overlay or a gel enhancement on a nail like that. All right, let's look at our next one. Okay, so this is white spots or leukonitis caused by illness. I don't know if I pronounced that right. These names are such difficult names to remember. I just know it from white spots caused by illness, sharp impact to the nail plate. It will grow out, and you may treat it normally. So it's not a dangerous condition in order to apply product onto that. However, this one, all right, is a wasting away of the nail. Onychotrophia, okay? Atrophy, wasting away of the nail. Can you see that whole nail bed is just totally wasted away? Causes the nail to lose its shine, it shrinks and it falls off. May be caused by injury, reactions to strong chemicals, internal diseases. Handle with extreme care. You need to refer someone like this to a physician. Do not apply nail enhancements or anything onto nails that look like this. All right. Our next one. Here we've got the overgrowth of the nail. It's very, very thick. Hypertrophy. Nails are abnormally thick. Extreme cases may be referred to a physician. All right. Sometimes with the thickness of the nails, you've got to debulk that thickness, but as a nail technician, I would refer to a physician and don't try and fix it yourself. And also don't take any chances by applying anything on top. All right, so here we've got ingrown nails, which can be very, very painful, caused by tight shoes, pressing down on the nail as we walk. So it pushes the growth of the nail down the side walls, creating ingrown nails. Nails grow into the tissue along the nail groove, causing improper filing, cutting, poor fitting shoes. So it's always important to corner off those corners, round those corners on the toes. Don't make it straight across, and then the corners just grow down into the side walls, which will cause ingrown nails. The nail corners must be trimmed to prevent the pressure on the nail, and you must see a physician. And I see we have a spelling mistake. All right, let's go on to our next one. Okay, so this is onychopsycosis. It's the discoloration of the nail. Turn a variety of colors, including blue. All right, they look like they're freezing cold and their nails turn blue. May be caused by poor blood circulation, heart condition. So your hands will always tell you what health you're in, your health state at that point in time. Oral medication or stomatic disorder. You have to refer a client like that to a physician. Do not apply any enhancements or any covering onto that nail. All right, here we're looking at onycholysis, which is loosening of the nail bed without shedding. It usually starts at the free edge and then it continues up to the lunar. Caused by internal disorder, trauma, infection, drug treatment, sharp stress by puncture or chemical irritation. So, if you've been over buffing on the nail and the nail plate is very, very thin, and you've been taking a sharp object to clean underneath the nail and the nail's thin, when you clean underneath that nail, you could lift it off the nail bed from the nail. So never try and clean your nails with a sharp object underneath if you've got thin nails, because you could create the stress and puncture the nail bed, creating onycholysis. All right, so very, very important. Also, if you're wearing very, very long nail extensions and your nail plate is very, very thin, you could bump that, creating the trauma, and the nail bed then lifting off the nail lifting off the nail bed. All right, let's look at this one. This is an eggshell nail. So it looks like an egg. It turns white and it curves over the free edge, caused by improper diet, internal disease, medication, nervous disorder. Very fragile nail, and it breaks easily. So a nail like this, you can definitely put an enhancement on. It will make the nail look a lot better than an eggshell, giving it a better appearance aesthetically. But just know that it's very fragile. So on a very fragile nail, I would prefer to use a soft gel because it's more flexible, so it will bend with the natural nail without causing any trauma to the nail. All right, let's look at our next one. This is a bitter nail. Okay, caused by a nervous habit that may be eliminated with the application of nail enhancement and regular manicures. Ski jump nails can occur due to excessive and prolonged biting of the fingernails. So you could distort your nails by biting them over a period of time, and then they eventually become ski jumped. But now I want to show you something. So nature has a wonderful way of protecting the matrix area. Can you see how the swelling on the free edge, the skin swells at the top, called a bulbous nail? That is to protect the matrix area and to protect that nail. So that is called a bulbous nail. This is definitely the type of person you would want to use for nail enhancements to help them to stop biting and to help their nails to grow. So that would definitely be a good candidate for nails. Here we've got the split or brittle nails, very, very brittle. You can see how brittle these nails are, which also makes them very, very thin. Okay, caused by injury, excessive use of cuticle solvents, polish removers, and rough filing. So this could be caused also by taking gel on and off, the nail becomes, the solvents eventually take out all the luster out of that nail, makes it very dry. The filing on top of that nail can sort of thin it out, and then you have the nail can split. This splits over the free edge because the nail is so soft. You've got to discontinue use of harsh soaps, removers, and improper filing. So on a nail like this, you would have to file very, very lightly, and you could use a ridge filler and normal manicure, or you could just do a natural nail overlay with a hard gel and let that grow out, so that you're not soaking off all the time. Just make sure that you do not file through the hard gel to the natural nail. So care has to be taken when applying to this condition. All right, here you can see your perigium, okay, your hypernechium. So nature has a way of, can you see how the skin has grown up underneath that free edge to protect the matrix and the breaking at the stress area. So the skin has grown up underneath to hold the length of that nail, because she's been wearing long nails for a very long period of time. Never cut the nail without looking underneath, because the hypernechium is fused underneath, and you could cause severe damage. All right. Take extreme care when dealing with a client with a hypernechium. Always check under the nails before you cut the nails. All right, let's look at our next one. Oh, look at this. This is a matrix infection. You can see the pus. You can see the redness, the inflammation around this nail. Probably caused from ingrown nails that could cause the inflammation. Bacteria gets caught in there, and then festers. So you can see there's pus and all sorts of things. You cannot apply anything on a nail like that. You have to send that to a physician. All right, now we're looking at nail curvature. So you can see this is an overgrowth of keratin on the nail, which sort of increases and enlarges. Particularly happens a lot with older people. The nail becomes very thick and then it curves because it's so thick. Could also be due to footwear, not proper nail care on the feet, and you need to have regular pedicures so that that doesn't happen. You need to debulk those nails. Um, the nail grows into the skin. Inflammation and pain could also be present. Causes at this point are unknown. However, send a client like that to a podiatrist for the podiatrist to take care of that nail condition. Don't attempt to do it yourself. All right, shredding of the nail. Part of the nail falls off. Can affect more than one nail, caused by fever and your system being upset. Reaction to prescription drugs result in trauma. So very, very important that if you do have shedding of the nail, make sure you do not apply any product on top of nail shredding, because the product will just lift straight off and you could cause more problems down the line. So here you can see a bacterial infection. You can see the redness around the cuticle area, and the nail fold is inflamed. All the tissue around there is infected. Could be used from unsanitary implements, aggressive pushing back of the cuticle area. So you don't want to do that. Here we have granuloma, severe inflammation. So if you are doing a pedicure and you see these big red blotches on the feet, luma of red tissue grows up from the nail bed to the nail plate, please refer to a physician. So you can see in this nail bed here, this red in the nail plate, refer to a physician. All right, and let's look at this onychomycosis. This is infectious disease caused by fungus. We've got a nail, we've got a spelling error here. Okay, this is whitish patches, can be scraped off, long yellowish streaks with the nail. So you've got a very porous nail here. Can evade deeper layers, appears thin, then peels off, exposing diseased part of the nail bed caused by poor circulation. So again, do not apply anything on top of that nail unless the physician has given you the go-ahead to do so. Well, I hope that helped you a lot to identify different nail diseases and disorders. Please take care while dealing with these problems, and I look forward to seeing you in the next module. See you soon.